My name is Dr. Patricia Yeager. I'm the CEO of the Independence Center in Colorado Springs. Lieutenant Governor, it's great to see you. We were on the Auraria campus, 35 years ago?
100 years ago.
Helping people with disabilities get through the college experience. So I'm delighted to see you and see you in the position that you're in. First of all, let me tell you that at the age of 2, I lost my hearing due to an interaction with a drug, terramycin. My hearing has grown to be of a severe level. I wear 2 hearing aids and do use captioning and lip reading as well. I run an organization of over 300 people with a budget of $13 million. We are a civil rights organization for people with disabilities, and we also run a home health agency. Many of my staff have disabilities, including deafness, blindness, mental health issues, any kind of disability you can feature. I probably have a staff or 2 that are working and making a difference in the community. In 2012, the then RICO, Regional Care Collaborative Organization, was in business, and I tried to work with HCPF to make that system accessible. It failed miserably. So when the RFP was in process for the current RAY contract, Regional Accountability Entities who organize or oversee Medicaid services to all people on Medicaid, including people who are deaf. There's 7 regions in the state. I got into the contract 5 things, and they're listed on this piece of paper. In the contract, first, the RAYs cannot discriminate against anyone with a disability among other minority status. Their website, the RAY's website, must be 508 compliant. Print alternative must be provided for materials offered in print. Sign language interpreters are to be provided, and the RAY is to pay for it. Accessible exam equipment, my favorite thing. This is an exam table and a scale that raises and lowers. They must be geographically dispersed throughout the RAY's area. And finally, healthcare providers must be disability culturally competent. That is in your contract. HCPF signed a contract with the federal government saying that it will ensure that the ADA we're in compliance with the ADA. And they have delegated in some ways that compliance to the RAYs. But there's no guidance, no information. The RAYs are struggling on their own on how to figure this out. And to my much delight, the RAYs now include mental health, behavioral health. And I'm delighted to see Aspen Point here. They have a new chief experience officer. It ain't your old Aspen Point if they've got a chief experience officer. They have sucked at services for hearing impaired for many years, people stuck in groups with no interpreters. I mean, it's just been, and the upper leadership could care less. And now they have a new leadership, and I'm putting you on the spot to say, you gotta fix this, and my heart is just open and hopeful that you being here will do that. But I'm back to the RAY. Because the RAY has the responsibility to make sure that these 5 contract requirements are followed both for healthcare and for physical health. And guess what? They're supposed to do it. They will pay. They're supposed to coordinate dental services as well. So now I'm giving everyone a copy of this, and on the back is a list of where all the RAYs are, the counties that they serve, and the phone number. And I'm asking every one of you to call them, not your provider, but call the member center and ask them to get you an appointment and to make sure the interpreter is there, because that is what they're supposed to do. Now, you know what's going to happen? They're going to say, we don't know anything about this. And in this document, you have the citation of where it is in the RFP. And their contract responses are on the website for HCPF. So you can look up what your region's contract was. I want to say to you, we're done. I mean, I hope we don't have to have a legal response to this. It's 30 years after the ADA, and many of us can't get services. We can't hear. What are you going to do? Would you go to another country and go to a doctor that you couldn't understand? What if you had appendicitis? What if you had a nervous breakdown or you know, you needed new drugs for your mental health issue? Would you go in that country to a doctor that you couldn't understand? Well, that's what all of us do in America. So you're a year and a half into this 7-year contract. And I can tell you, other than Grand Junction, which I hear some good things about Grand Junction, I hear nothing good about the others. People are not, the deaf community, how many of you know about the Ray? Raise your hand if you know about the Ray. There you go. 3 people, maybe 4. So the Rays are not reaching out to us. And this is the deaf community. I mean, I could go on about all the other disabilities as well, but Cliff has told me I can only talk about mental health and deaf services, so that's why I'm here to do this. But I'm telling you, the Ray is supposed to do this. And they're going to balk. They're going to say, no, we're not. If you have that experience, please let Cliff know. Please send an email to Cliff or to me. My email is on here, because we want to know the experience you have. Keep it up. Tell your friends, keep calling them so that they get the pressure to provide services. Please fix this before the 7 years of this contract is up. Thank you.